Hi everyone, I'm Dr. Pore Pop, board-certified facial plastic surgeon, and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which means I help people look as young and vibrant as they feel. And welcome back to another episode of Skin School. Today we're going to talk about a very common, often misunderstood, skin condition, rosacea. Now, if you've ever dealt with facial redness, flushing, visible blood vessels, breakouts that aren't exactly acne, there's a good chance you might be dealing with rosacea. And like melasma, rosacea comes with a lot of myths, misinformation, and frustrating treatment options that don't always work. In today's episode, we're going to break down what rosacea really is, what causes it, what makes it worse, and most importantly, what treatments actually work, and which ones may make it worse. Part 1. What is rosacea? So let's start from the top. What exactly is rosacea? Rosacea is a chronic inflammatory skin condition that primarily affects the face. You'll usually see it on the cheeks, nose, forehead, and chin, but it can also show up around the eyes or even the chest in some cases. The most common symptoms include persistent redness or flushing, small visible blood vessels, we call these telangiectasias, red bumps or pustules that look like acne but aren't burning or stinging sensations, and in some cases, thickening of the skin, especially around the nose. Rosacea can affect both men and women, although women are more frequently diagnosed, especially those between the ages of 30 and 50. And just like melasma, rosacea doesn't discriminate. People of all skin tones can have it, though it's often underdiagnosed in darker skin types because the redness isn't as visible. Part 2. What causes rosacea? Now the big question, why does rosacea happen? The honest answer, we don't know everything. But we do know a few key contributing factors. Genetics. There's definitely a hereditary component. If your parents or siblings have rosacea, your chances go up. Immune system dysfunction. Some studies show an overactive immune response, specifically involving a protein called cathelicidin, which triggers inflammation in the skin. Demodex mites. These are microscopic mites that naturally live on the skin. In people with rosacea, they tend to be more abundant and may trigger or worsen inflammation. Vascular instability. That's a fancy way of saying the blood vessels in rosacea-prone skin are extra reactive, leading to flushing and visible capillaries. Gut-skin connection. There's emerging evidence linking rosacea with gut imbalances. Things like SIBO, small intestinal bacterial overgrowth, and food intolerances can play a role. So it's multifactorial. And here's the key thing. Rosacea is a chronic condition. That means we don't have a permanent cure, but we can absolutely manage it and get it under control. Part 3. Common triggers to avoid. Before we jump into treatment, we need to talk about triggers, things that can cause flare-ups or make rosacea worse. Here are the most common ones. Sun exposure. Just like melasma, UV radiation is one of the biggest culprits. Hot beverages and spicy foods. Alcohol, especially red wine stress, and emotional extremes. Heat, hot weather, hot showers, saunas. Skincare products with irritating ingredients, like alcohol, menthol, or exfoliating acids. Certain medications, including topical steroids, if used long-term. So the goal isn't to live in a bubble. It's to understand your specific triggers and manage them where you can. Part 4. What not to do. This is a really important section because a lot of treatments that work beautifully for acne or pigmentation issues can absolutely make rosacea worse. Things like harsh exfoliants, glycolic acid, salicylic acid, scrubs, strong retinoids. Unless you're carefully guided by a dermatologist, laser or heat-based treatments. If done improperly, these can flare rosacea. Fragrance-heavy skincare products. If you've tried products that made your skin feel hot, red, stinging, or more inflamed, that's your skin telling you to stop. Part 5. What does work? My treatment philosophy. So what does help? I like to think of rosacea treatment in 3 buckets. 1. Barrier repair plus calming inflammation. Start here. The skin barrier is everything. I recommend a gentle, non-foaming cleanser, fragrance-free, soothing moisturizers. Think ceramides, niacinamide, panthenol. Avoiding over-cleansing or exfoliating too. Topical treatments. These are some of the main options. Metronidazole, prescription, anti-inflammatory, and antimicrobial, azelaic acid, gentle brightener, and anti-inflammatory ivermectin cream. Helps with Demodex mites, brimonidine gel. Reduces visible redness by constricting blood vessels. 3. Lifestyle plus internal health. Identify your food and stress triggers. Try a probiotic if gut health might be involved. Use mineral sunscreens daily, zinc oxide or titanium dioxide only. And lastly, laser treatments like pulsed dye or IPL can be effective for visible vessels or redness, but they need to be done by someone experienced with rosacea-prone skin. So here's the bottom line. Rosacea is frustrating. I get it. It's unpredictable, chronic, and it's different for everyone. But when you really understand the underlying causes and you treat it with respect and the right tools, rosacea can absolutely be managed. I've helped hundreds of patients find relief and confidence again. And you can too. If you found this helpful, please like, subscribe, and share it with someone who needs to hear this. And let me know in the comments, what's been your biggest challenge with rosacea? I'd love to hear from you. Thanks for watching, and I'll see you next time on Skin School.